Explain the considerations that must be taken into account when calculating medication dosages for pediatric patients. What specific guidelines can a pharmacist refer to when adjusting dosages for children? Answer: when calculating medication dosages for pediatric patients, several considerations are essential due to the differences in pharmacokinetics and pharmacodynamics compared to adults. Key factors include weight and age. Pediatric doses are typically calculated based on the child's weight (mdg) or body surface area (EMGM). It's crucial to use accurate measurements of weight and height. Developmental factors. The age of the child can affect drug absorption, distribution, metabolism, and excretion. Neonates and infants may metabolize drugs differently than older children and adults. Dosage guidelines. Pharmacists should refer to established dosing guidelines such as the Pediatric Dosage Handbook or the Harriet Lane Handbook, which provide specific dosing recommendations for various medications. Renal and hepatic function. The maturity of renal and liver function must be considered, as both organ systems are not fully developed in younger children, impacting drug clearance. Describe the importance of calculating accurate flow rates for IV infusions. What could be the consequences of inaccurate flow rates? Answer: accurate calculation of flow rates for IV infusions is crucial for several reasons. Therapeutic effect. Maintaining the correct flow rate ensures that the patient receives the medication at the intended therapeutic dose over a specified time. Inadequate flow may lead to subtherapeutic effects, while excessive flow could result in toxicity. Patient safety. Incorrect flow rates can cause serious complications, including fluid overload, which can lead to heart failure or pulmonary edema, especially in vulnerable populations such as the elderly or those with renal impairment. Medication stability. Some medications have specific stability profiles and may degrade if infused too quickly or too slowly. This can impact the effectiveness of the therapy. Monitoring. Pharmacists must also consider the need for regular monitoring of the patient's response and adjust the flow rates as necessary. Guidelines. The Institute for Safe Medication Practices provides recommendations on safe IV practices, including the need for double-checking calculations. What factors must be considered when preparing diluted solutions in a pharmacy setting? Discuss the importance of isotonicity in this context. Answer: when preparing diluted solutions, pharmacists must consider several factors. Concentration of the stock solution. The initial concentration must be accurately determined to ensure the final solution meets the required dosage. Diluent selection. The choice of diluent can affect the stability and solubility of the drug. Common diluents include sterile water for injection and normal saline sterility. All equipment and workspace must be sterile to prevent contamination, particularly for IV preparations. Isotonicity. Solutions should be isotonic to avoid causing hemolysis of red blood cells or other cellular damage when administered IV. Pharmacists must calculate the osmolarity of the solution to ensure it matches that of body fluids, typically around 285-300 mosmol. Compatibility. Consideration of drug interactions and stability is crucial when mixing different substances. Guidelines. The United States Pharmacopoeia OS provides guidelines on preparing sterile products, including dilution protocols. Discuss the clinical significance of monitoring electrolyte levels in patients receiving IV fluids. What specific guidelines should pharmacists follow when addressing electrolyte imbalances? Answer: monitoring electrolyte levels in patients receiving IV fluids is vital due to the following reasons. Homeostasis maintenance. Electrolytes like sodium, potassium, and calcium are crucial for maintaining homeostasis, cellular function, and overall fluid balance. Imbalances can lead to serious complications, including arrhythmias, muscle weakness, and neurological disturbances. Therapeutic drug levels. Some medications can affect electrolyte levels, for example, diuretics can lead to hypokalemia. Regular monitoring allows for timely interventions if imbalances occur. Patient populations at risk. Certain populations, such as those with renal disease, heart failure, or those receiving aggressive fluid resuscitation, are at higher risk for electrolyte imbalances. Guidelines. Pharmacists should follow recommendations from the American Society of Health System Pharmacists (ASHP) and the National Kidney Foundation, which provide protocols for monitoring and correcting electrolyte levels, including adjusting IV fluid composition and dosing based on lab results. Explain how the volume of distribution (VD) influences drug dosing. How does the VD affect the calculation of loading doses? Answer: the volume of distribution (VD) is a pharmacokinetic parameter that describes how extensively a drug disperses into body tissues compared to the plasma. It is significant for the following reasons. Drug distribution. A large VD indicates extensive distribution into tissues, suggesting that higher doses may be needed to achieve effective plasma concentrations. Loading dose calculation. The loading dose is calculated to quickly achieve therapeutic drug levels and is influenced by the VD. The formula for calculating the loading dose LD is L desired plasma concentration. Therapeutic monitoring. Understanding the VD allows pharmacists to predict how long a drug will remain in the system and its potential side effects based on its distribution. Guidelines. Pharmacists can reference resources like the Clinical Pharmacokinetics textbook for detailed dosing strategies based on V. Pharmacists must convert medication dosages from mg/mg for a particular compound. What steps should be followed to ensure accuracy in this conversion, and what common pitfalls should be avoided? Answer. To accurately convert dosages from mg/mg, the pharmacist should follow these steps. Know the conversion factor. Recognize that 1 mg is equal to 1000 mg. This fundamental relationship must be applied correctly in calculations. Perform the conversion. Multiply the milligram value by 1000 to convert to micrograms. For example, if a dose is 2 mg, UMG esto 1000 mg double check calculations. Always double check the calculations to prevent errors, especially in high stakes environments. Use of conversion tools. Pharmacists may use software or reliable conversion tables, but must understand the conversion process thoroughly. Pitfalls to avoid. Common pitfalls include misunderstanding the conversion factor and confusing mg with meg, which can lead to significant dosing errors. Analyze the potential impact of drug-drug interactions in patients taking multiple medications. What steps should a pharmacist take to prevent adverse interactions? Answer. Drug-drug interactions could significantly impact patient safety and treatment efficacy due to the following. Mechanisms of interaction. Interactions can occur through pharmacokinetic changes, e.g., altered absorption, metabolism, excretion, or pharmacodynamic effects, e.g., additive or antagonistic effects. Patient outcomes. Adverse interactions can lead to toxicity, therapeutic failure, or increased side effects, which can complicate patient management. Prevention steps. Comprehensive medication review. Pharmacists should perform thorough medication reconciliations at each visit, including over-the-counter medications, supplements, and herbal products. Utilization of drug interaction databases. Pharmacists should use reliable databases and software to identify potential interactions. Patient education. Educate patients about the importance of reporting all medications they are taking and signs of potential interactions. Discuss the relevance of understanding the half-life of a medication in relation to patient management and therapeutic drug monitoring. Answer. Understanding the half-life of a medication is essential for several reasons. Dosing frequency. The half-life helps determine the appropriate dosing interval. Medications with a short half-life may require more frequent dosing to maintain therapeutic levels, while those with a long half-life can be dosed less frequently. Therapeutic drug monitoring. Knowledge of a drug's half-life aids pharmacists in scheduling therapeutic drug monitoring to ensure effective and safe dosing. Drug accumulation. In cases where a drug is administered continuously or frequently, understanding its half-life helps predict potential drug accumulation and the risk of toxicity, particularly in patients with renal or hepatic impairment. Guidelines. Pharmacists can refer to pharmacology textbooks or drug prescribing information for specific half-life data, along with monitoring recommendations. Evaluate the importance of patient education in the management of chronic diseases requiring pharmacotherapy. What specific strategies should pharmacists employ to enhance patient understanding? Answer. Patient education is crucial for managing chronic diseases for the following reasons. Adherence to therapy. Educated patients are more likely to adhere to their prescribed treatment regimens, which is essential for effective disease management. Self-management. Empowering patients with knowledge helps them make informed decisions regarding their health, recognize side effects, and understand the importance of lifestyle modifications. Strategies for effective education. Use of teach-back method. This involves asking patients to explain the information back to the pharmacist, ensuring understanding. Simplified language. Avoid medical jargon and use clear, concise language to enhance comprehension. Visual aids. Incorporate charts, diagrams, or pamphlets to illustrate complex concepts. Guidelines. The Centers for Disease Control and Prevention (CDC) and the Health Literacy Universal Precautions Toolkit provide frameworks for effective patient education. What steps should a pharmacist take if they suspect that a patient is attempting to misuse their prescription medication? Answer. If a pharmacist suspects that a patient may be misusing prescription medication, they should take the following steps. Gather information. Review the patient's medication history, including previous prescriptions and refill patterns. Check the CURE's database to identify any discrepancies or patterns of concern. Engage the patient. Approach the patient in a non-confrontational manner. Ask open-ended questions to gain insight into their medication use and any challenges they may be facing. Document findings. Keep detailed records of any observations, conversations, and actions taken. Documentation is essential for legal compliance and may be important if further actions are required. Consult with healthcare providers. If the pharmacist continues to have concerns, they should contact the prescribing physician to discuss the situation. Collaboration with other healthcare providers is critical for patient safety and appropriate management. Educate the patient. Provide information about the importance of using medications as prescribed, including the risks associated with misuse and the potential for withdrawal or other complications. Offer resources for support if needed. Discuss the concept of collaborative practice agreements, CPAS in California, pharmacy practice and their significance. Answer: collaborative practice agreements, CPAS, are formal agreements between pharmacists and physicians that allow pharmacists to manage and modify patient medication therapy under specified conditions. Key components of CPAS: scope of practice. CPAS must clearly outline the specific duties that pharmacists are authorized to perform, including medication adjustments, ordering tests, and monitoring patient outcomes. Patient population. The agreement should specify the patient population involved, including any disease states or conditions that the pharmacist will manage. Quality assurance. CPAS should include provisions for ongoing monitoring and evaluation of the pharmacist's performance and patient outcomes, ensuring that the agreement meets established standards of care. Significance. Enhanced patient care. CPAS empower pharmacists to take an active role in patient management, leading to improved medication adherence, better health outcomes, and increased access to healthcare services. Interprofessional collaboration. CPAS foster collaboration between pharmacists and prescribers, allowing for a team-based approach to patient care that maximizes the expertise of each healthcare provider. Legal framework. Establishing CPAS provides a legal framework for pharmacists to engage in advanced practice, ensuring that they operate within the bounds of California law while providing high-quality care. Overall, CPAS represent a progressive shift in pharmacy practice, emphasizing the importance of pharmacists as essential members of the healthcare team. Explain the requirements for pharmacy technicians in California and their role in the pharmacy setting. Answer: in California, pharmacy technicians are vital support personnel who assist pharmacists in various functions. Within the pharmacy setting, their roles are defined by specific regulatory requirements. Licensure. Pharmacy technicians must obtain a license from the California Board of Pharmacy. This involves submitting an application, paying a fee, and passing a background check. Education and training. Technicians are typically required to have a high school diploma or equivalent. Completion of a pharmacy technician training program is often encouraged, though not mandated. Continuing education. Licensed pharmacy technicians must complete 20 hours of continuing education every 2 years to maintain their licensure, including a focus on pharmacy law and ethics. Role in the pharmacy. Medication preparation. Pharmacy technicians are responsible for preparing medications for dispensing, including counting, measuring, and labeling medications accurately under the supervision of a licensed pharmacist. Customer service. Technicians assist patients at the counter, answer basic medication-related questions, and help with prescription processing and insurance claims. Inventory management. Pharmacy technicians help maintain inventory levels, conduct stock checks, and order medications and supplies as needed. By supporting pharmacists in these roles, pharmacy technicians play a crucial part in ensuring the efficient operation of the pharmacy and enhancing patient care. Describe the process and requirements for reporting adverse drug events (ADES) in California. Answer: in California, reporting adverse drug events (ADES) is essential for improving medication safety and enhancing public health. Process: identify ADES. Pharmacists must identify and evaluate any adverse events associated with medication use, including side effects, allergies, and medication errors. Document the event. Detailed documentation of the ADE is crucial, including the patient's demographics, the medication involved, the nature of the event, and any interventions taken. Report to the appropriate entities. In California, ADEs can be reported to the California Department of Public Health and other relevant organizations, such as the FDA MedWatch program. Reports should be submitted promptly and contain sufficient information for investigation. Requirements. Mandatory reporting. Certain deaths, particularly those that result in serious harm or require medical intervention, may be mandated to be reported by state law. Confidentiality. While reporting is essential, the confidentiality of patient information must be maintained following HIPAA guidelines. Reports should not include identifiable patient information unless necessary for safety purposes. Significance. Reporting ADEs helps identify patterns, inform healthcare professionals, and lead to improvements in medication safety practices. Continuous education and training for pharmacy staff on ADE reporting are crucial to fostering a culture of safety within the pharmacy. By understanding and implementing the ADE reporting process, pharmacists contribute to improving patient safety and enhancing the overall quality of care. What are the legal and ethical considerations pharmacists must take into account when providing medication therapy management (MTM) services? Answer: providing medication therapy management (MTM) services involves various legal and ethical considerations that pharmacists must navigate to ensure high-quality patient care. Legal considerations. Scope of practice. Pharmacists must operate within the scope of practice defined by state laws and regulations. They must ensure that any recommendations or interventions align with their training and the collaborative agreements in place. Documentation. Accurate and thorough documentation of MTM services is required for legal protection and compliance. This includes documenting assessments, recommendations, and patient interactions. Confidentiality. Compliance with HIPAA regulations is essential when handling patient information. Pharmacists must safeguard patient confidentiality throughout the MTM process. Ethical considerations. Patient-centered care. Pharmacists must prioritize the needs and preferences of patients, ensuring that recommendations are tailored to individual circumstances and health goals. Informed consent. Pharmacists should obtain informed consent from patients before initiating MTM services, explaining the process and potential benefits and risks involved. Conflict of interest. Pharmacists must avoid situations where personal interests could conflict with the best interests of patients, including receiving incentives for recommending specific medications or products. By adhering to these legal and ethical considerations, pharmacists can effectively provide MTM services that enhance patient outcomes while maintaining professionalism and integrity in their practice. A pharmacy technician has been observed dispensing medications without a pharmacist's verification. What actions should the pharmacist take in response to this situation? Answer: the pharmacist must address the situation promptly and appropriately to ensure compliance with state regulations and maintain patient safety. Actions should include immediate intervention. Stop the technician from dispensing medications until the issue can be resolved. Emphasize the importance of pharmacist verification before any medication is dispensed. Investigation. Conduct a thorough investigation to determine the extent of the issue. Review the technician's actions and any medications dispensed without verification. Staff training. Reinforce training and clarify the scope of practice for pharmacy technicians, emphasizing that they cannot dispense medications without the pharmacist's verification. Document the incident. Keep detailed records of the incident, including dates, times, and specific medications involved, as well as any corrective actions taken. Policy review. Review pharmacy policies and procedures to ensure they align with state regulations and provide guidance for handling similar situations in the future. Report if necessary. If there are serious violations or if patient safety was compromised, the incident may need to be reported to the California Board of Pharmacy. What are the requirements for record keeping of controlled substances in a pharmacy in California? Answer: California law mandates specific record-keeping requirements for controlled substances to ensure accountability and regulatory compliance. Key requirements include inventory records. A biennial inventory of all controlled substances must be conducted and documented. Records must include the quantity, dosage form, and location of each controlled substance. Dispensing records. Accurate records must be maintained for all controlled substances dispensed, including patient name and address, prescriber's name and DEA number, date of dispensing, drug name, strength, and quantity, prescription number. Records of returns and destruction. Documentation must be kept for any controlled substances that are returned to the supplier or destroyed, including the method of disposal. Prescription records. Prescription records must be maintained for a minimum of 3 years, including all information as required by the California Pharmacy Law. CURE S reporting. Pharmacists must report controlled substance dispensing to the California Prescription Drug Monitoring Program (CURES) within 7 days to monitor for potential abuse and diversion. Adhering to these requirements is essential for compliance with California Controlled Substances Act and for promoting patient safety. A patient presents a prescription for a drug that is not listed on their insurance formulary. What options does the pharmacist have to assist the patient? Answer: in this situation, the pharmacist has several options to assist the patient while ensuring they receive their medication. Key steps include: verify insurance coverage, confirm the patient's insurance formulary status and determine whether the prescribed medication is indeed not covered. Discuss alternatives, offer alternative medications that are on the formulary and may be therapeutically equivalent. Provide counseling on the alternatives and the potential for switching. Contact the prescriber. If necessary, communicate with the prescribing physician to discuss the possibility of changing the prescription to a covered alternative or obtaining prior authorization if the medication is still necessary. Patient assistance programs. Inform the patient about patient assistance programs provided by pharmaceutical companies or non-profit organizations that can help cover the cost of medications. Out-of-pocket options. If the patient opts to pay out of pocket, provide the cost of the prescribed medication and discuss potential savings options or generic alternatives. Explain the role of the California State Board of Pharmacy in regulating pharmacy practice. Answer: the California State Board of Pharmacy (BOP) plays a crucial role in regulating pharmacy practice to ensure public safety and compliance with laws. Key functions include: licensing. The BOP is responsible for licensing pharmacists, pharmacies, and pharmacy technicians in California. Regulatory enforcement. The board enforces California pharmacy law and takes disciplinary actions against licensed professionals who violate regulations, which may include fines, license suspension, or revocation. Continuing education. The BOP sets requirements for continuing education for pharmacists to ensure they stay current with evolving practices and regulations. Consumer protection. The board investigates complaints and allegations against pharmacists and pharmacies to protect public health and safety. Policy development. The BOP develops and updates regulations to reflect changes in healthcare practices, technology, and patient safety initiatives. It also provides guidance and resources for pharmacists to enhance practice standards. Advocacy and education. The board engages in public outreach and education to inform consumers about pharmacy services and the role of pharmacists in healthcare. During a routine follow-up consultation, the pharmacist notices that a patient with chronic heart failure is experiencing shortness of breath and edema. Upon reviewing the patient's medication list, the pharmacist identifies that the patient is not taking their diuretics as prescribed. What steps should the pharmacist take to address this medication-related problem, and how does this reflect on the principles of medication therapy management (MTM)? Answer: the pharmacist should take the following steps to address the medication-related problem. Assess the reason for non-adherence. Conduct a patient interview to understand why the patient is not taking the diuretics. Barriers could include side effects, lack of understanding of the medication's importance, or financial constraints. Educate the patient. If the patient is experiencing side effects, the pharmacist should discuss potential strategies to mitigate these effects. For example, advising the patient to take the medication at a different time of day may help reduce nocturia, a common side effect. Collaborate with healthcare providers. If the patient is experiencing significant side effects or if there is confusion regarding the medication regimen, the pharmacist should contact the prescribing physician to discuss alternative therapies or adjustments to the dosing schedule. Develop a patient-centered care plan. Work with the patient to establish a more manageable medication schedule and encourage adherence through reminder systems, e.g., pill organizers, alarms. Why are effective communication techniques critical in pharmacy practice, particularly in counseling patients with varying levels of health literacy? Describe specific strategies a pharmacist can implement to improve communication with patients. Answer: effective communication is essential in pharmacy practice because it ensures that patients understand their medications, the importance of adherence, and how to manage their health conditions. Given the diverse levels of health literacy, pharmacists must adapt their communication styles to ensure all patients can grasp critical information. To improve communication with patients, pharmacists can implement the following strategies. Use plain language, avoid medical jargon, and use simple, straightforward language. For instance, instead of saying antihypertensive, say blood pressure medication. Teach back method. After providing information, ask the patient to explain it back to you. This confirms their understanding and allows you to clarify any misconceptions. Visual aids. Use diagrams, pamphlets, or videos that illustrate medication administration techniques or lifestyle changes related to chronic conditions. Visual aids can enhance comprehension for patients with limited literacy. Cultural sensitivity. Be aware of cultural differences that may influence communication styles, preferences, and health beliefs. Tailor counseling to respect and integrate these differences. Use of interpreters. For patients who speak limited English, utilize interpreter services to ensure accurate communication. When assessing a prescription for a controlled substance, what specific considerations should a pharmacist take into account to prevent prescription abuse or diversion? Provide a comprehensive overview of relevant regulations and best practices. Answer. When assessing a prescription for a controlled substance, pharmacists must be vigilant to prevent abuse or diversion. Key considerations include patient history. Review the patient's medication history, including previous prescriptions for controlled substances. Use databases such as the California Prescription Drug Monitoring Program (PDMP) to check for overlapping prescriptions or potential misuse. Appropriateness of therapy. Evaluate whether the prescribed medication is appropriate for the patient's condition. For example, consider if non-controlled alternatives exist for managing pain or anxiety. Prescriber verification. Ensure that the prescriber is licensed and authorized to prescribe controlled substances in California. Contact the prescriber directly if there are any concerns about the legitimacy of the prescription. Patient counseling. Educate the patient about the risks associated with controlled substances, including the potential for addiction. Ensure that they understand the importance of taking the medication exactly as prescribed. Documentation. Maintain comprehensive records of all assessments, including rationale for filling or refusing the prescription. Proper documentation is essential for legal and regulatory compliance. According to California HSC Section 11165, it is a violation to fill a prescription for controlled substances that the pharmacist knows is not issued for a legitimate medical purpose. These practices are critical in safeguarding against prescription drug abuse and ensuring patient safety. What is the process for conducting a comprehensive medication review (CMR) in the pharmacy setting, and what legal guidelines govern this practice in California? Answer. Conducting a comprehensive medication review (CMR) involves a systematic process that allows pharmacists to evaluate a patient's complete medication regimen to identify and resolve medication-related problems. The steps include patient assessment. Begin with a thorough assessment of the patient's health history, including medical conditions, current medications, prescription and over-the-counter, and any supplements. Gather information regarding adherence, side effects, and patient preferences. Medication analysis. Review the patient's medications for potential issues, including drug interactions, therapeutic duplications, inappropriate dosages, and medications that may no longer be necessary. Identifying MRPS. Identified and categorized medication-related problem MRPS, such as adverse effects, lack of efficacy, or contraindications. Developing a care plan. Collaborate with the patient to create a patient-centered care plan that addresses identified MRPS. This may involve adjustments to therapy, referral to other healthcare providers, or providing education on medication use, follow-up, and monitoring. Establish follow-up protocols to reassess the patient's response to therapy and make necessary adjustments to the medication regimen. In California, the practice of CMRS is governed by California BPC Section 4052.2, which permits pharmacists to provide medication management services, including CMRS. Compliance with state and federal regulations ensures that these reviews are conducted ethically and effectively, ultimately enhancing patient care and safety. Describe the importance of collaboration between pharmacists and other healthcare providers in managing patient care. How can this collaboration improve patient outcomes, and what legal considerations should pharmacists keep in mind? Answer. Collaboration between pharmacists and other healthcare providers is vital in managing patient care effectively. This teamwork leverages the unique expertise of each discipline, leading to comprehensive and coordinated care for patients. Improved patient outcomes. Collaborative practice enables healthcare teams to share critical information about a patient's medication regimen, enhancing therapeutic outcomes, identify and resolve medication-related problems collaboratively, which can reduce adverse drug events and hospitalizations. Tailor treatment plans based on interdisciplinary input, ensuring that all aspects of a patient's health are considered. Enhance communication. Effective collaboration fosters open lines of communication, allowing for real-time sharing of patient information and immediate adjustments to treatment plans as necessary. Legal considerations. When collaborating with other healthcare providers, pharmacists must adhere to the following legal guidelines. Ensure compliance with California BPC Section 4052.2, which allows pharmacists to provide patient care services and collaborate within the scope of their practice. Protect patient privacy in accordance with HIPAA regulations, ensuring that any shared information is done so securely and only with the necessary parties involved in the patient's care. Maintain accurate records of all collaborative interventions, including communications with healthcare providers and changes made to the patient's medication regimen. By adhering to these legal and ethical guidelines, pharmacists can ensure that their collaborative efforts lead to improved patient safety and health outcomes while maintaining compliance with regulatory requirements. How can pharmacists assess health literacy among patients, and why is this assessment crucial for effective patient counseling? Outline specific strategies pharmacists can use to evaluate and enhance patient understanding of their medications. Answer: assessing health literacy is essential for pharmacists to tailor their counseling strategies effectively. Health literacy refers to a patient's ability to understand health information and make informed decisions about their care. Assessment strategies: ask open-ended questions. During consultations, pharmacists can ask patients to explain their understanding of their medications and the instructions given. This helps gauge their comprehension level. Use standardized tools. Implement tools such as the Single Item Literacy Screener, SILS, or Rapid Estimate of Adult Literacy in Medicine realm to quantify health literacy levels. Observe nonverbal cues. Pay attention to patients' body language and expressions. A confusion or hesitance can indicate a lack of understanding. Enhancing patient understanding. Use plain language. Communicate instructions in simple, jargon-free language, focusing on key points that patients need to understand about their medication. Teach back method. After providing information, ask the patient to repeat it back in their own words to confirm understanding and clarify any misinterpretations. Visual aids. Utilize charts, diagrams, or written instructions that illustrate medication administration, side effects, and the importance of adherence. Follow-up. Schedule follow-up consultations to assess the patient's understanding further and address any questions or concerns. By systematically assessing health literacy and adapting communication styles accordingly, pharmacists can significantly enhance patient engagement, adherence, and health outcomes. This practice aligns with California BPC Section 4110, which emphasizes the pharmacist's role in promoting effective patient education. Describe the importance of patient counseling in pharmacy practice and how it contributes to medication safety. What specific information should pharmacists provide to patients during counseling sessions? Answer: patient counseling is a crucial component of pharmacy practice that enhances medication safety and adherence. It allows pharmacists to bridge the gap between healthcare providers and patients, ensuring that patients understand their therapy. Effective counseling helps prevent medication errors, reduces adverse drug reactions, and improves treatment outcomes. During counseling sessions, pharmacists should provide comprehensive information, including indication and use, explain why the medication is prescribed and its intended purpose, dosage and administration, clarify the proper dosage, timing, and method of administration, e.g. with food, without food, how to use inhalers, etc. Potential side effects. Discuss common and severe side effects, encouraging patients to report any unusual symptoms promptly. Drug interactions. Inform patients about potential interactions with other medications, foods, or supplements. Storage instructions. Provide guidance on how to store the medication properly to maintain efficacy. Pharmacists should encourage questions and ensure patients feel comfortable discussing their concerns. This proactive approach not only fosters a therapeutic relationship but also empowers patients, leading to better medication adherence and overall health outcomes. Relevant guidelines, such as the Medication Therapy Management (MTM) standards, support the importance of counseling in promoting safe medication practices. A patient with diabetes presents with a new prescription for metformin and requests to continue using a herbal supplement for blood sugar control. As a pharmacist, what steps should you take to evaluate the safety and efficacy of this supplement? Answer: as a pharmacist, it is essential to ensure the safety and efficacy of any herbal supplement a patient intends to use alongside prescription medications. The following steps should be taken. Gather information. Inquire about the specific herbal supplement, including its name, active ingredients, dosage, and duration of use. Understanding the patient's full medication regimen, including over-the-counter drugs, is crucial. Assess evidence. Review available scientific literature, clinical studies, and resources such as the Natural Medicines Comprehensive Database to evaluate the safety and efficacy of the herbal supplement concerning diabetes management. Identify interactions. Check for any potential interactions between metformin and the herbal supplement, including increased risk of hypoglycemia or altered drug metabolism. Consult guidelines. Refer to established guidelines on the use of complementary and alternative medicines in diabetes care to inform the patient appropriately. Educate the patient. Discuss the potential risks and benefits of combining the herbal supplement with metformin, emphasizing the importance of monitoring blood sugar levels closely. What role does pharmacogenomics play in personalized medicine, and how can pharmacists implement pharmacogenomic principles in their practice to optimize medication therapy? Answer. Pharmacogenomics, the study of how genes affect a person's response to drugs, plays a vital role in personalized medicine by allowing healthcare providers, including pharmacists, to tailor medication therapy based on an individual's genetic makeup. This approach enhances treatment efficacy, minimizes adverse effects, and improves overall patient outcomes. Pharmacists can implement pharmacogenomic principles in their practice by educating themselves and staff. Staying informed about pharmacogenomic testing and its implications for drug therapy helps pharmacists make informed decisions regarding medication selection and dosing. Patient genotyping, collaborating with healthcare teams to identify patients who may benefit from pharmacogenomic testing, especially for drugs with known genetic interactions, e.g. warfarin, clopidogrel. Interpreting results, analyzing pharmacogenomic test results to guide therapy adjustments such as changing drug types or dosages based on genetic profiles. Counseling patients, educating patients about the benefits of pharmacogenomics, including how their genetic makeup may affect drug responses and adherence to therapy. Discuss the significance of adherence to medication regimens in chronic disease management and the pharmacist's role in promoting adherence. What strategies can pharmacists employ to support patients in this regard? Answer. Adherence to medication regimens is critical in chronic disease management as it directly impacts treatment effectiveness, patient health outcomes, and overall healthcare costs. Non-adherence can lead to disease progression, increased hospitalizations, and higher healthcare expenditures. Pharmacists play a pivotal role in promoting medication adherence through various strategies. Patient education. Providing clear, understandable information about the disease, medication purpose, and the importance of adherence fosters patient engagement and understanding. Simplifying regimens. Assisting patients in creating simplified medication schedules, such as using pill organizers or recommending combination products, can help reduce complexity. Regular follow-ups. Establishing follow-up appointments or using telepharmacy services to monitor adherence, assess side effects, and make necessary adjustments can enhance patient support. Motivational interviewing. Employing techniques that encourage patients to discuss their barriers to adherence and collaboratively finding solutions empowers them to take ownership of their health. Utilizing technology. Encouraging the use of medication reminders through mobile apps or automated alerts can help patients stay on track with their regimens. Pharmacists can also collaborate with healthcare providers to identify patients at risk for non-adherence and implement targeted interventions. By prioritizing adherence, pharmacists contribute significantly to improving chronic disease outcomes and enhancing the quality of care. What are the key components of a robust quality assurance program in a pharmacy, and how does it contribute to medication safety and operational efficiency? Answer. A robust quality assurance CAR program is essential in pharmacy practice, ensuring medication safety, improving operational efficiency, and enhancing patient care. Key components of a QA program include standard operating procedures (SOPs), developing and implementing SOPs for all pharmacy operations, including dispensing, compounding, and inventory management, ensures consistent and safe practices. Error reporting systems. Establishing a non-punitive environment encourages staff to report medication errors and near misses, facilitating learning and process improvement. Regular audits and inspections. Conducting routine internal audits and inspections helps identify compliance gaps and areas for improvement, ensuring adherence to regulatory standards and best practices. Staff training and education. Continuous training and professional development for pharmacy staff foster a culture of safety and competence, keeping them updated on new protocols and technologies. Patient feedback mechanisms. Incorporating patient feedback into the QA program allows for real-time insights into service quality and areas needing enhancement. Performance metrics. Establishing key performance indicators. KPIS related to medication safety, error rates, and patient satisfaction enables the pharmacy to measure effectiveness and drive improvements. By integrating these components, a QA program enhances medication safety and operational efficiency, fostering a culture of continuous improvement and ultimately contributing to better patient outcomes. Compliance with relevant guidelines, such as those from the Joint Commission, further reinforces the commitment to quality assurance in pharmacy practice. David, a 40-year-old male with a history of opioid use disorder, visits the pharmacy to refill his buprenorphine and naloxone prescription. He expresses concerns about stigma and is unsure if he should continue his treatment. How should the pharmacist respond to support David in his recovery? Answer: the pharmacist should take the following actions. Provide a supportive environment. Reassure David that his treatment is valid and important for his recovery. Emphasize that seeking help for substance use disorder is a courageous step and that many people successfully manage their condition. Educate on the benefits of MAP. Discuss the importance of medication-assisted treatment in reducing cravings and withdrawal symptoms, as well as improving overall quality of life. Provide information on how buprenorphine and naloxone works to prevent misuse and support recovery. Address stigma, acknowledge David's concerns about stigma, and provide resources such as local support groups or counseling services that focus on recovery from substance use disorder. Encourage him to connect with peers who understand his experiences, and encourage regular follow-up. Recommend that David maintain regular appointments with his healthcare provider to monitor his progress and discuss any challenges he may face. Offer to assist him in coordinating care.